All right, so it's interesting. If someone had to ask me right now what is one of my favorite procedures to do, the one I would tell them might surprise them because I don't feel it's so exotic. But at this stage in my career right now, I absolutely love the breast reduction. I'm amazed at how many women carry very, very large breasts, which causes them quite a bit of discomfort in neck, back, and shoulder pain, bra strap moving. They have rashes. They can't exercise the way they want to. They've got back pain that requires injections, or they got scoliosis associated with having large breasts. They can't wear clothes that make them feel feminine. Everything they wear makes it look like a tent, so they never feel thin. And because they can't exercise too well, they're usually not in the best of shape. Breast reduction kind of puts together all the aspects of plastic surgery that I love. I'm helping a patient out who has some discomfort and a problem. There's an aesthetic component. I get to really shape and sculpt a beautiful breast, which makes someone feel very feminine, very confident. And there's an artistic component to that. For selfish reasons, it's about a 2.5 hour operation, which is kind of a nice packaged operation. It's outpatient, which is great. Patient gets to go home. They don't have to spend the night in the hospital. Barely anyone ever uses narcotics. And I don't get a lot of phone calls. So, and it's got about a 99% patient satisfaction rate, which is great. So taking care of happy people all the time is phenomenal. So I'll say that is one of my favorite operations right now. As far as exotic operations that I remember throughout the course of my career, probably two in particular. One is I had a gentleman come to me who had a penectomy. So he lost the majority of his penis due to cancer. He had about a 1 centimeter stump. He was in his 50s, not in the best shape, the hypertensive, diabetic, and no one else would take this guy on. And his chief complaint to me was, I don't feel like a man. Because when I go to the bathroom, I can't urinate standing up. And he came to me with his wife, and we had this really sincere conversations relatively early in my career. I sent him out. It's interesting, I learned a funny lesson with this. I sent him out for a bunch of tests thinking there's no way he's gonna pass all these tests. The doctor's not gonna say it's okay. I'm not gonna get clearance from his doctors to do this operation. But I got him. So I did a penis reconstruction on him. I built a penis from the tissues of his forearm, and I rolled the skin and fat from his forearm, based it on an artery, the radial artery. It's called a delay procedure. So I just had it stay in that position for 3 months. I put him in a splint and let it just be there and mature for 3 months. And then 3 months later, I went to the OR. I dissected out vessels in his groin, and I connected the penis reconstruction to the vessels in his groin, and had a urologist attach it to the stump of his penis. And he loves it. We're still Facebook friends right now. So he's a good guy, and he's doing really well with that operation. And I think I solved this problem because he could definitely urinate standing up after that. And he could do a little bit more with it. But that was one case that really stuck with me. Also, when I was in Dallas, was this young boy, 4 years old, who his step-parent, he was sucking his thumb, and his step-parent put tape around his thumb so tight that it choked off all the blood supply, and it caused his thumb to necrose, which means die, and he had his thumb amputated. And the thumb is one of the most important parts of the hand. And so for him, I did an operation I learned in my fellowship under Neil Jones. Shout out to Dr. Jones at UCLA. It was a toe-to-hand transfer. So I took his second toe, I dissected all the vessels and tendons and nerves out, and then I got the space on the stump of his thumb ready. I dissected all the bones and tendons and nerves and vessels out, and I reconnected the two. And you connect everything. You connect the tendons so it moves, and the nerves so it can feel things, and the vessels so it has the blood supply, and the skin. And it worked extremely well for him, and he went back to having very normal hand function. It made me feel really great. And that's one of the operations I really remember as well.